Well, hi, here we are again. Imogen here with Body Intelligence, here with my friend and client and now collaborator for some workshops and courses for people dealing with trauma and chronic stress, Shay Seaborne. And yeah, Shay's experience as a trauma survivor and her understanding of the neuroscience relating to trauma has just kind of been paired really nicely, I guess, with the practical tools and concepts from my body intelligence work. So today we wanted to come on and just talk. We think this will probably be quite a brief conversation, we'll see, but talk about the idea of why having a sense of agency is particularly important for anyone living with trauma or chronic stress, and how having a very gentle and non-coercive approach to calming your nervous system can really help you become more regulated. Yeah, so that's what we're going to talk about. So actually, before I ask Shay, I want to describe what happened with me and how I kind of came up with kind of by accident, in a way, having this particular approach. I think that approach is maybe in my personality a little bit, but it became specifically about the way I would ask my clients to think and how to explore. And then in particular, I discovered that using the phrase, I am free to whatever, really helped my clients free up in whatever they were doing, experience more ease, a little bit of letting go, a little bit more spaciousness. When they prefaced it with that I am free to, which of course means I don't have to. And not having to do something, it kind of seems paradoxically help them to get that result, for want of a better word. Very different from, I want you to relax now. Can you just try and relax, please? You know, even if I said that very gently, I said it a little bit harshly then, but you know, just relax. But you know, you're free to notice a little bit of ease right now is different. So I kind of came upon this as being a more effective way to help my clients let go and release tension. But what I wanted to talk to Shay about is why that there was another dimension to this that became apparent to you that was particularly important to you as a trauma survivor and someone dealing with chronic stress and dealing with trauma and all of that. So yeah, so welcome, long introduction, but I thought it was quite interesting to kind of share how I kind of landed on this way of doing things.
Yeah, thank you for describing that. You've mentioned it to me before, but I never heard the whole thing. So it's really nice because it just reinforces that you have a really good sense for this. And really, all of us are innately driven toward the things that help us feel better. And we often just have blockages to that because, like many of the things in our culture tell us not to do those very things. And your ability to listen and notice and pay attention to how it was affecting you and your clients is part of the reason I love working with you. And the idea of just relax was such a perfect example. You know, how many times I hear that as a PTSD survivor, just relax, it's going to be okay. Yeah. That is not reassuring. And even if I can accept that and try it, I'm trying to make myself do something that is not appropriate for the setting, rather than trying to make myself relax. I need to notice ease.
So can I just interrupt for a second about the just relax thing? I do want to just say that I didn't say that even before. I think most people trained in the Alexander technique would not use
Yes.
those particular words, but I might have said something like, allow your neck to be free, which is a lot gentler. But still, how do you know how to do that? Even the allowing, how do you know how to do that? So, yeah. So
yes, especially if you have spent your life not being allowed to do those things, like your trauma.
Yeah.
Like, what's the first step for allowing? Can you describe that in 3 easy steps, please?
I feel like most people, including myself, don't know what allowing or letting something happen. How do you do that? You know, is the question for most of us.
It just happens, right?
Yeah.
And that's with the noticing. When you notice, it just happens. And as we've discussed before, the first time I worked with you way back when it was in person, and I was noticing, I couldn't notice any ease in my body at all initially. And with a little bit of practicing and co-regulation and encouragement from you, I could finally notice this little spot right here has some ease. With trauma, so many times it involves losing a sense of agency, a sense of control over things, particularly if the trauma was relational, which is most developmental trauma includes relational. Even if your parents were just neglectful and not actually abusive, that's a relational harm that affects. So relational harm comes with losing agency, and anything that pushes against where somebody is going to naturally be received by the nervous system as a threat.
So coming back to that kind of key phrase, I am free to, or free to notice ease, or it could be I'm free to do something else. That kind of contains within it a choice, right? That you don't.
Yes, I don't have to notice any ease. I'm free to, but that doesn't mean I have to. And if I didn't, it was okay. And yet by just repeating that, I'm free to notice, that opened the space for that little tiny dot. And now look at me. I'm a bucket of these.
Indeed.
Well, relatively, I still have a long way to go, but relatively, yes.
Oh, yes. So I think consent ties in with this too. It's like you have within that type of thinking, you are in a way asking your deeper self for consent, or it's going to, and if it's not right for you to notice ease in that moment because something is important for your safety, for instance, then you're going to pay attention to that.
Yes.
Have I put that together in
very well. That's exactly it. If my environment isn't conducive to noticing ease, I'm not going to. The hallmark of trauma is hypervigilance. So my nervous system is primarily focused on looking for external threat, namely in the form of human beings, because that's where the harm came from. So yes, if I don't have the resources to notice ease, I'm not going to. And it's not even permission. It feels like permission, giving myself permission, but it's not even that. It's just allowing myself to notice or not. That's where my allowing comes in. And
I think it's allowing and allowing. You have permission to allow it from yourself if you want to. I'm getting tied up in the words, but
and in all cases of agency, the option to say no is crucial. You can't say fully yes unless you can also say no.
So I wanted to ask you if you would share with us how you have devised a little practice with one of your primary doctors who's been helping you, that kind of deals with this idea of consent, and maybe in some way stems from the ideas that we've talked about and worked with together. So I believe you call it the Patel Pause. But anyway,
Yes.
can you just tell us what you've come up with? It might be helpful.
Yeah, I'd be glad to. And yes, it did come from our practices. First of all, just after so many years of practicing noticing ease, I also notice many other things that are going on inside me. I have much greater awareness of my internal landscape. And that's really beneficial, especially as I need to be in touch with it in order to understand what helps me heal. So
it gives us so much information which we can't respond to if we don't know
if we
it
don't
or
even know
recognize it. Yeah.
Yeah. The interoception is invaluable. So yeah, my doctor and I came up with this Patel Pause when he had given me a painful procedure that he always says, you're welcome to say stop and we can pause, or just quit whatever you need to do. And I know that cognitively, but my nervous system was trained by my early environment to, hold still, take it, shut up, grit, bear it, and all that. So I noticed that during one of the procedures, it hurt. Like 3 of the shots were okay, and 2 of them hurt like crazy, but I didn't say anything. I just told myself, oh, don't interrupt him. It'll be a hassle, and it's just going to be a few seconds and it'll be over. And, like all these justifications that were instilled in me. And afterward, I told him that, and he was horrified, poor thing. And I said, so next time we do this, can we like plan for me to tell you to stop? Because this is really important for me to like have a man stop hurting me when I say stop. What a novel idea for my nervous system. So he agreed and actually changed the procedure. He came up with the Patel Pause idea, where he would put the capped needle against the tissue, and I would tell him to stop, and he would stop, and then he would do it again and stop. So that would like prepare the area for the shots, and give me some practice with saying no and having him stop in this very safe container of medicine in his office. And it worked so well. Like every time he stopped, my whole body went, yay! So I think go ahead.
I think you also told me how now you've done this with him, and I think maybe other medical professionals now.
Yes. It's spreading.
Yeah. For different things, but how the nature of how you are able to tell someone to stop now has changed. The quality, the ease within you, perhaps, of being.
It's just fascinating to observe this and kind of be a living experiment. So I felt so encouraged by my response to Dr. Patel doing the pause that I started telling my other providers, asking them to do it too. So we do it 3 times, before they begin whatever work has their hands on me. And particularly with my PT, because I see him 3 times a week, and he really understands the nervous system and is really glad to help me with this. So he just, puts his hand wherever. Initial consent first. We figured that out too. Like, don't touch me until I say okay is really, really important. And the thing is, I trust him. Like cognitively, I trust him. If he does touch me without permission, I feel perfectly fine. Like there's no threat from him. And when we do the Patel Pause, my whole nervous system gets so happy. And I noticed initially I would tell them to stop by saying, stop. Like I had to almost pop them with it, because that's what my nervous system thought I had to do. I practically arm wrestle it out of them. And as I recognized this, I decided to try going easier and easier. And now I can just whisper and just stop. It's just so magical to have somebody
he still
hear me.
stops.
Yeah, to have somebody hear me and stop. It's just so good for my nervous system. So I'm spreading that through all of my providers, and hope they do it with other patients too.
Yeah. So we have in our work together and the work that we're going to share in the workshop, of course, actually, that's starting in about 10 days, 14th of February. But we practice this. It's very important, kind of like you had to practice saying stop, but the practices that you learn in our course that help you cultivate this gentle, coercive,
Non-coercive
quality. Yeah, sorry. Yeah, absolutely. Non-coercive. So it's not only important from what comes from outside of you, but in the way that you speak to yourself. Right?
Very much so. Yes.
Yes. So that it's probably a little kinder and more loving to yourself, I would think. So
it is. And again, that's another really important facet of healing from trauma or chronic stress. The thing we need most is kindness, and particularly from ourselves and those very close to us.
Yeah. So agency, choice, gentleness, kindness is all part of what we do together. Let's put it like that.
And so really, that's all part of creating safety. And that's what Bessel van der Kolk says, safety is the therapy. So anytime that we are in a safe place, in a safe interaction with other people, that's part of the therapy.
That's really interesting. And then you're practicing ways to help you feel safer in other situations, or
just the noticing ease can help me feel safer in other situations. Like when I had to go to the Surgery Center of the hospital that has repeatedly harmed me and been unaccountable, and it's a monopoly, so I don't have much choice. I had to go there for a procedure, and it's a very unsafe place for me. And I'm pretty sure I couldn't have done it if I hadn't been practicing all this for so long. I know I've described before how I walked in and just dissociated from my body. I was somewhere up at the ceiling, and I couldn't do the cycle or some of the other practices per se that are my normal go-to because I was so dissociative. But I could still remember to just notice if there was any danger. And I looked around and said, do I see any threat? I noticed there's no immediate threat. And that helped my nervous system settle just a little bit, and it made it tolerable enough for me to keep going. Otherwise, I'd have run out of there.
You are very brave, and you are very courageous. Anything else about this topic before we finish up? She ended up talking a little longer than I expected, but maybe that's not unexpected. Yeah. So I'll pop information about the Foundations of Regulation course that Shay and I have are offering. It's an online course on Monday evenings at 6:30 US Eastern Time, just for 4 weeks. I'll pop that in the comments area. And we're going to do another video next week. And our topic is curiosity and why cultivating, I guess, curiosity and being curious is another crucial element in recovery or healing or de-stressing, having a good life. Okay. All right. Thank you so much, Shay. Always interesting and to talk with you. Thanks.
Thank you.
Okay. And if anyone has any questions, just pop them in the comments. We'd be happy to get back to you. All right. Bye.